Honorable Philip JPA, our party leader and leader of the opposition, and I want to join him in thanking all of our delegates and supporters for a wonderful conference and convention season, and to congratulate him again on his resounding vote of confidence from our delegates. Ladies and gentlemen of the press, good morning once again. This is a statement on the healthcare crisis and the healthcare situation in St. Lucia today. The St. Lucia Labour Party has observed with trepidation that recently the crisis in healthcare in St. Lucia has worsened. On Sunday, 11th November, even more physical evidence of worsening conditions at the Victoria Hospital and the St. Jude Hospital has surfaced. The stated intentions of the government for the St. Jude Hospital in the short to medium term is nothing more than madness and needs immediate clarification. In addition, while the crisis deepens, the commissioning of the OKEU Hospital is showing little progress and being conducted under a cloud of secrecy. The St. Lucia Labour Party has been reliably informed of the following. 1. Medical services being offered to patients at the Victoria Hospital continue to be affected by inadequate supplies and deteriorating conditions at the hospital. Patients are being admitted but kept in the emergency unit because of insufficient beds, and in some cases having to remain seated in the unit for days. Medical and ancillary members of staff at the Victoria Hospital are growing increasingly anxious with the slow transfer from the Victoria Hospital to the Owen King EU Hospital. Additionally, the reported plans by the government to privatize the Owen King EU Hospital, in addition to the uncertainty of the jobs of nurses, have created even more confusion and acceleration of public anxiety about the worsening healthcare situation. Visible proof of falling ceilings and structures within the wards, in particular the maternity ward of the Victoria Hospital, has caused the public of St. Lucia increased disquiet and fear. 2. It is now 2.5 years since work on the St. Jude Hospital project was brought to a halt by the UWP government with no good reason provided by the government. The advice of experts have been set aside, and instead government ministers continue to make uninformed proposals about the future of the hospital. The UWP administration adamantly refuses to consider completing the east wing of the St. Jude Hospital and transfer the patients of the hospital to that structure, which by many professional accounts can accommodate the staff and patients who are at the George Odlum Stadium. 3. The UWP administration has decided that the original St. Jude Hospital structure will be handed over to a foreign private company to be operated for profit. 4. The Prime Minister has stated that he and his cabinet are considering the construction of a field hospital to house the patients and staff from the George Odlum Stadium. According to Google, a field hospital is defined as, and I quote, a temporary hospital set up near a combat zone to provide emergency care for the wounded, unquote. Why would a government consider such a harebrained idea and the attendant costs when they have been advised by experts that the east wing of the existing St. Jude complex, if completed, can accommodate the patients and staff now housed at the George Odlum Stadium? Why would they want to build a field hospital? Are there special benefits for members of the government and their friends? Is this what St. Lucians deserve? Only Alan Chasney and his cabinet of collaborators would even consider such absurdity. This idea of building a field hospital to accommodate the St. Jude Hospital has to be rejected with all the contempt that it deserves. 5. Further confusion has been added by the Prime Minister when he revealed that there is also active consideration being given to transferring the patients from the George Odlum National Stadium to Victoria Hospital. It is obvious that the government has dug a hole for itself by the senseless stoppage of the St. Jude Hospital project for the past 2.5 years. So now it is scrambling from one irrational proposal to another absurd proposal. This all demonstrates how clueless this government is in the management of this country's health sector and the business of the country in general. The St. Lucia Labour Party warns that the current situation in healthcare affects all St. Lucians, health professionals, public servants, business owners, politicians, the clergy and their followers. We are all affected by the deteriorating health conditions in our country. All of us. So if there is anyone who believes that they are not in it, think again. Is the UWP administration waiting for further disaster? Does the Prime Minister care about the health of St. Lucians? While the UWP administration has put work at the St. Jude Hospital site on hold and bungling the commissioning of the OKEU hospital, it is, however, spending millions on roads for a racetrack which belongs to a foreign investor who has reduced the Prime Minister to a puppet. Yes, the Prime Minister has become Theo Aking's puppet. Millions more have been wasted in tax waivers, and more recently, millions to be paid as a result of the mismanagement of the Range Hotel project. Our hospitals and healthcare do not seem to be a priority for this government. It is clear that the UWP administration and the UWP cabinet continues to disregard with callous contempt the constant calls by the people of St. Lucia to give more priority to healthcare concerns. The St. Lucia Labour Party calls on the government to urgently return to the commissioning process, which would transfer services from the Victoria Hospital to the modern OKEU, which has modern equipment, and to update the people of St. Lucia on the status of the commissioning exercise. The government is also called upon to respond to the constant calls by the people of St. Lucia to pay attention to the worsening conditions at the St. Jude Hospital and to continue work on the East Wing so as to remove patients and staff from the George Odlum Stadium, which has been deemed as unfit to carry on as a hospital by the government's own health and safety experts. The people of St. Lucia cannot be allowed to continue suffering and dying while Alan Chasney refuses to pay attention to their health concerns. I thank you. I will be available for the Creole translation in a while.